Hello, my name is George Green and I'm the CEO of Water Missions International, and it's been almost 2 years since I gave you an update on Project Safe Water Cologne, so I thought it'd be good to give you an update because so much has been accomplished over the last 2 years, and I want to just take a few minutes to tell you about that. And then we're going to show you some of the technology that's been developed, and we're going to let you meet some of the people whose lives have been impacted. We estimate that over 300,000 people in that department are drinking clean water as a result of this project. 100 water systems from Safe Water Cologne. On the sanitation side, over 11,000 sanitary pit latrines have been installed. The health impact study, a landmark study. This data, as you know, has been published in several scientific journals, demonstrates with scientifically defensible data that when water systems are placed in a community, we can expect to see a decrease in the incidence of waterborne disease of 52%. That's enormous, a huge impact, and you, Pentair, are to be thanked for that. Okay, so I talked earlier about a lot of new technology that's been developed as a result of Safe Water Cologne. This is the living water treatment system, the latest revision that was developed as a result of the work that's been done through this project. It's much more compact. It's now all of the process equipment and all of the flow control valves are contained in one cage, where previously it was 2 cages. Additionally, we've reconfigured all of the valving so that the operation of the system is much more intuitive to the operator. This device right here is the new chlorinator. Tremendous improvement over the old chlorinator, which was actually made out of standard plumbing parts. This chlorinator has been specifically designed to optimize the erosion of the 3-inch tablet so that we can have better control over the chlorine concentration. This is the mini chlorinator. It's designed to attach directly to the outlet of the biosand filter and add a controlled amount of chlorine. This, we believe, is the solution to the biosand filters.
My name is Jeff Deal. I'm the Director of Health Studies for Water Missions International. Also have a second position in the area. I'm the Director of Anthropology and Water Studies for the Center for Global Health at the Medical University of South Carolina. So most studies, and previous to our work, had simply asked people, are you feeling better? Are you having lower diarrhea rates? And of course the answer often is yes, because they're thankful for what you've done. And we know that methodology is fraught with problems. So we developed this, we began to sample people for whether or not they carried a waterborne pathogen in those 3 categories of communities. And we gathered several hundred stool samples. We reviewed 1,400 medical records, and we plotted the prevalence of people who came in, the number of people who came in that had a potential waterborne illness. When we looked at the medical records for the number of people coming in for diarrhea rates, that was a 52% drop in rates. That's a huge, huge drop. And if you extrapolate that out to on a worldwide level, what you're looking at is thousands of people each day potentially have their lives saved because of this.
Sí, mi nombre es Francisco Nicolás Vázquez, soy el técnico en salud. Sí, nosotros a la gente que nos mira de Misión del Agua y de la Fundación Pentair le damos el gran agradecimiento. Agradecemos porque realmente son personas que son solidarias a la gente más desprotegida de este país. Y eso viene a mejorar las condiciones de salud en la parte de parasitismo intestinal y en la parte también de los problemas de diarrea. Los índices han sido elevados.
Estamos aquí con Argelia, ella es enfermera de este centro de salud. ¿Cómo era antes de todo esto la comunidad?
Bueno, en primer lugar, para decir, era totalmente problema porque el agua que había era completamente contaminada. Había muchos casos de diarrea, casos de disentería. Eso se llama salud preventiva. Se ha hecho en gran parte al 100%, por decir prevención total, porque se está tomando agua al 100%, la verdadera, decimos nosotros, le decimos a la gente, ya no hay diarreas. Nosotros ha sido de gran provecho, gracias a ustedes y a Dios al mismo tiempo, ¿verdad?
¿Y ya no, papi? Venga, yo te damos.
Buenas tardes, mi nombre es Edwin Alejandro Hernández Gutiérrez. Estamos aquí reunidos hoy en la cooperativa Colón, agradeciéndole a Misiones del Agua, Fundación Pentair, por el proyecto de la purificadora aquí y por 75 letrinas que vinieron a hacer aquí y que se ha visto el cambio en la comunidad, como ha venido a reducir las enfermedades y todo aquí, calentura, diarrea.
Es de mucha importancia para nosotros, para los adultos y para los niños también que tomen agua purificada.
Esta agua nos sirve mucho aquí. Antes teníamos más problemas, ahora están, gracias a Dios, están solucionados, ¿verdad?
Pues que legalmente lo que estamos tomando del agua, sentimos la gran diferencia, bastante fuerte.
Ya no estamos tomando agua contaminada, sino que agua saludable. Y agradecemos de parte de la comunidad que estamos siendo beneficiados a Fundación Pentair y Misiones de Agua.
Mucha gente viene a traer agua aquí a la purificadora y nosotros les agradecemos en una manera grande.
Yo quiero darle gracias a Pentair.
Gracias a Pentair.
Gracias.
Gracias Pentair.
Gracias a Pentair.
Gracias Pentair.
Esta es mi letrina y gracias a Pentair.
Esta es mi letrina y doy gracias a Pentair.
Gracias Fundación Pentair.
Gracias Fundación Pentair.
Hola, mi nombre es Jeffrey Miguel López Ocampo, alcalde municipal de la capital de la citricultura, aquí en el municipio de Zonaguera, Colón. Es increíble cómo ahora vamos a tener agua de calidad y saneamiento en nuestros barrios. Muchas gracias y que Dios bendiga a Misiones de Agua y Fundación Pentair.
I hope this has given you an opportunity to get a better idea of the work that you've made possible and the lives that you've impacted in Honduras. And I would say in closing that not only have you impacted lives in Honduras, but the technology that's been developed as a result of your grant and the community development programs that have been accomplished and the health impact study that was developed is now being replicated in many, many other countries, in Africa and other parts of the world. You have made a huge impact far beyond what can be measured on many people's lives. On behalf of Water Missions and most importantly on behalf of the people whose lives you've impacted, thank you.
Doy gracias a Pentair que nos hizo este regalo.
Gracias Fundación Pentair.